Good day. My name is Carolyn Stegman, and for many years I worked at MAC, and now I'm a volunteer for what I feel is a very worthwhile organization. MAC covers the whole Lower Shore, which is Dorchester, Wycomico, Worcester, and Somerset County. It's a non-profit board run by a board, 16 members that represent all of those 4 counties. MAC means maintaining active citizens, and it's your area agency on aging. I'm here today with a very special guest, Peggy Bradford, who for 37 years was the executive director at MAC and now is happily retired but working as a consultant at MAC and also as a volunteer. Peggy and I are going to talk about a subject that is very near and dear to our personal lives and to the lives of so many older people that we've been dealing with at MAC, and that is late life depression. Peggy, so welcome. I'm glad to be here with you.
It's always fun, Carolyn, to be with you. You know, over the years, many times we've talked about depression. We've held seminars and workshops on depression because, indeed, depression is a condition that impacts so many older people, yet often it goes unnoticed.
Exactly. So what you have is we think about younger people and so on, and oftentimes it gets masked with older people because they have so many more risk factors, like a chronic disease, which can cause pain and suffering, or stroke, or heart disease, or arthritis, or Parkinson's, or any number of those conditions. As a matter of fact, I think it's like 80% of all people over 65 have at least one chronic disease condition, whether it be diabetes or hypertension, or even glasses is considered to a certain point disability. And of course, my disability with glasses is very mild, but other people have macular degeneration where they really do, in fact, lose their eyesight. And then 80% have one condition, and 50% have 2 or more.
Yep. You've often heard the Betty Davis saying, aging is not for sissies. And indeed, depression often happens as we age, yet all too often we don't even understand that we might be depressed, or we may be in denial, embarrassed, or it presents as something totally different than what you normally think of as depression.
And depression in older people can lead to suicide. And when older people attempt or complete a suicide, they're much more successful. What is the highest rates now with some of the older people that you've heard?
Well, 25% of all suicides in this country are committed by older people.
That's a lot of people.
I think second only to very young people. We never even think about that because we're so focused on youth and the danger of suicide. But with older people, indeed, there's a great risk, particularly with older white men. I can relate a personal story to you. My grandmother had a very dear childhood friend. And they had gone out to dinner. As a matter of fact, it had been a church dinner, and they had been enjoying themselves when he said, I think I need to go home. I'm just not feeling quite right. She said, well, that's fine. We'll visit with each other at church later on. And he went home, and he took a rifle, and he went out to his barn, and he murdered himself. Suicide. And she was so shocked. And indeed, we all were shocked. But when we look at the statistics, what do we see with older white males? That's a very common way they end their lives.
Guns. Because they're very serious. They're not going to take a chance that pills might not work or even a car accident or whatever, suicide by car or whatever. They're very serious, and they're going to take a gun, and they're going to make sure that they're successful. Why do you think men more than women?
I think some of it may be connected with losses they've never been able to deal with. And as we know, we're now older people. There are so many losses that happen as you age.
Absolutely.
Loss of some of your physical abilities, mental abilities, loss of status. You retire. So, I've recently retired. I had 37 years on the job, and indeed it was a loss to leave all that behind.
I feel the same way because we're both in the same boat there. Yes, losses.
So men have troubles filling that void.
I think women tend to have more socialization skills, or have been. They chat more, and they also live longer, so there's more women. And so there tends to be less isolation, but that's another risk factor, is you lose somebody, a significant person in your life, a significant partner, or even a pet. And oftentimes, Peggy, I find we disenfranchise the death of a pet. We don't realize how meaningful it really is. Well, we could say something like, oh, it was just a dog or just a cat. Or we could say, you can always get another one. Well, when you're 80 years old and you've lost the loving pet that is 15 or whatever the age of the pet was, no. That is not something you're thinking about. You're thinking about that death right there and how much that means to you.
Particularly if you live alone. The pet becomes the significant other being in your life. You have a reason to live. People have pets live longer. They exercise more. I mean, the caring for something that loves you unconditionally.
That's right.
Is so very special. And another thing you think about is, will I ever have another pet? If I'm 80 years old or 85 years old, will I be able to care for another pet for 10 or 15 years?
That's
so
right.
It may be your last one. And it's indeed very difficult, that type of loss.
I've heard an old person one time describe when they said, how is it aging? And she said, I'm good for one more dog in my life, But now I know we're encouraging older people to go to the Humane Society and adopt also an older pet. As a matter of fact, some older pets have survived their loved ones, the owner who has died first, and then they do not get another home, and so they end up, in the Humane Society. So we've talked about that.
Yeah, that's indeed an excellent choice. An older pet may be just the right match. I want to go back to one of your earlier points when we were talking about men and depression. The loss of a spouse, huge for men. They have so much more difficulty than women dealing with that kind of loss. Along with dementia too. Dementia, early Alzheimer's is also very closely linked with depression. It's sort of like a double whammy of losing my spouse, I lost my spouse, of losing my memory. So many losses.
In fact, we've noticed that symptoms of dementia can also serve as a mask for depression. So sometimes the presenting complaint to a physician or to us at MAC is they'll come home and they're not remembering things like the names of their grandchildren or whatever it is. And upon closer looking at history and physical and all that, we'll see that they're actually depressed.
They're depressed, yes.
Yes. And, and then because depression, you cannot just take a blood test and then the results of the blood test say, oh, you're depressed. It's really talking. It's a history and it's a physical. It's to rule out other diseases, and it's to also, look at what's happening in your day-to-day life, and the doctor's going to ask you that. And a lot of times the doctor will say, so how are you doing? How are you feeling mentally? I'm fine. Because the stigma, oh, I don't want him to think I'm crazy. Well, depression is a disorder of the neurotransmitters in the brain. And just as it's sort of an imbalance like diabetes or hypertension, we also have treatment, very successful treatment for it in terms of medication and other things like that. So, yeah, a lot of times people get scared that they're really, really sick. And so they suffer. They're in pain and they suffer.
Yeah, as you mentioned, we have seen it so many times in the past. Memory loss happens with depression. And it may be the presenting symptom. A few other things. Disruptions in sleep. Hey, you're low energy. You're so tired. You can't even move. Yet you'll go to bed and sleep an hour or two, and then you're awake.
Right. Or in some cases, it can be just the opposite. You go to bed for 10 hours. You know, some people. So, in other words, it's a change in your sleep pattern. We're talking now, and you'll see this on the screen, the symptoms of depression. And they're the whole gamut. So, not enough sleep, too much sleep.
A deep sense of loss and emptiness. People often use the word, I feel so empty, I feel so hopeless. And I want to differentiate it from grief, because we have losses associated with grief, entirely normal, but you don't have that prolonged sense of emptiness and despair.
And what I found out too, Peggy, as a death educator, is that that often grief and depression, they look the same, particularly after the death of a very significant person in your life. But if after a few months, like 6 months, say, nothing makes you happy, nothing can put a smile on your face, then we start saying, well, maybe this is not totally grief here. Maybe there has been a trigger into a clinical depression. And that's when it's time to go to the doctor to talk about that. So yes, grief is depressing. The loss is depressing, and all of us are going to go through that. But if after a while we can't seem to recuperate and move on in any small ways, the grandchildren hugging us or going out to lunch with friends or whatever, if nothing we can do, then we're going to look at depression.
Even through grief, we still have times when we can laugh and smile and feel joy. With depression, it's not there.
Right.
It's that deep, empty, dark feeling.
People feel worthless. And they feel irritable sometimes, and they're unable to concentrate, and all kinds of things like that. It's just amazing. Also appetite, and we have the whole range of emotions, from sitting there with a gallon of ice cream to eating nothing. And so regardless of, even if somebody is eating, sometimes what they're eating is not healthy, and that's going to affect your health. And it seems like a vicious cycle as you start not eating or drinking even, and sometimes alcohol. They'll do that to combat depression, when in fact alcohol is a depressant. And or drug abuse. Any of those things can happen. I remember my father one time, who suffered, he's been deceased now for 10 years, but he suffered from depression after the death of my mother. And he had several operations on his shoulder and his hip, and then ended up with Alzheimer's disease. And one time he said to me, Carolyn, I don't know if it's worth the oxygen. And I'll never forget him saying to me, it was such a profound statement of him saying that, I really don't want to live anymore. And while my father died of natural causes, he could have probably, and that's because the Alzheimer's took him down, and he was not cognizant enough to commit suicide. But I'm sure he could have been one of those elderly white men who would have finally done it.
Let's talk a little bit about some medications that many older people take that are linked with depression.
Okay, go ahead.
We start with hypertensive meds, High blood pressure, very common in older people. There's a whole list of medications out there, and some of them indeed are associated with depression. So that's one thing that you need to have your physician take a look at your medication. If you're feeling very blue, down, depressed, let's take a look at your medication regime. Maybe taking medication for high cholesterol, some of the statins. That's another potential side effect that can cause depression. Medications to help you sleep.
Yes.
Medications for arthritis, particularly the cortisone family. I have a friend who was taking using the cortisone inhalers due to severe problems with allergies, and became quite depressed. And he was able to determine that indeed it was that medication which was causing the feelings of depression. The medication, he went off the medication, then back to his normal self. But we often don't think about those things. And as you noted earlier, there's the stigma and embarrassment that people have with depression. And it's time to take that stigma and put it away.
Absolutely. It's time not to suffer. I mean, there's enough, as we say, aging ain't for sissies. But also there's some suffering we don't need to do. It's hard enough to be old without suffering when you don't need to. And so when you have a late life depression, whatever the causes might be, the treatment is, can be so helpful, and you don't have to go through the pain. Besides the medications, too, that are used to treat late life depression, there's also talk therapy. And therein lies another stigma for, well, I'm not crazy, or keep your skeletons in the closet, or keep a stiff upper lip, or, any number of those things that sometimes, particularly people that I'm a baby boomer, so people that were in my mother's and father's generation will feel that way. And so I had one woman say, I just need to pray more. And recently we've had now many ministers and rabbis and priests who are very aware of the increased incidence of late life depression, and will say to their congregants, God has given us doctors and nurses and mental health professionals to help you deal with this, and to help them to accept it. Have you seen that too?
Absolutely. And that is a very positive sign for us, because people may go to their minister,
yes,
their clergyman, and talk about these feelings of emptiness, loneliness, worthlessness. And it's good that these folks now are helping them understand, it's okay. You need treatment, let's get the treatment, and you're going to be so better for it.
Right, exactly. We had a client come to MAC many years ago, and he had lost his wife, and he was sitting at home in a lazy boy watching TV all day and eating, horribly. And we got him into the senior center, and it wasn't long when he could recognize that he was depressed. And all of a sudden, the socialization of meeting new friends, of having other people that had suffered loss just like he had. And then he went to his doctor, and he turned out to be much more honest with his doctor than he had ever been before. The honesty is just so important, and people won't do it.
That's something that I've seen so many times over the year working with older people, that if they become re-engaged in life,
yes,
that the depression will lift.
Yes.
The re-engagement, the socialization, the being with others sort of focusing outside yourself.
That's right.
Is one of the key things that you can do. And indeed, it's difficult because there's very little energy when you're depressed. You know, there is help out there. There are groups available.
Grief groups.
Groups.
Yes.
Various support groups. MAC offers a caregiver support group.
Yes. Talk about depressing. Yes.
Now, that is one group of people who have such a heavy burden or load, or family caregivers. You know, as you're aware, many are just as frail as the individual for whom
That's right.
for whom they're caring.
It's 24/7.
24/7, very stressful. The person they're caring for may be depressed, and they too may become depressed. They come to our support group meetings. They talk with one another, and they find out, well, when my loved one did this, this is what I did. This is what worked for me. Here's how I helped him get dressed in the morning, or eat, or take a bath, whatever the issue was. Here's how I dealt with that difficult behavior. So they found somebody who understood the problem, which is very significant.
That's right. That's right.
And then they got some direction. So I think a message that we have to offer today is you're not alone. There are others who have been there who can help guide you.
Don't isolate.
Don't isolate.
And those seniors, when they come in, and when you mentioned before, Aging Aid for Sissies, that it's not just one loss that some of us have with a very significant person in our lives, but we're watching our friends die. I mean, I'm 70. You're younger than I am. But I have buried in the last year 3 or 4 friends, because it's going to increase exponentially now as we get older, as my friends get cancer or get a disability or whatever it is. And we're going to need to come to each other and to nurture and show compassion, because it is going to happen until one day we all notice that, hey, I wonder where my place in line is to the grave. You know, and that's what a lot of people are thinking. And so you want to live as much as you can until that it is your turn.
Yeah. I think if we have a couple of messages to convey today, one is depression is not a normal part of aging.
Amen. Yes. Say it again. Depression is not a normal part of aging. It is not inevitable that you will get depressed the older you get. Go ahead.
And if you become depressed, there is help available.
Right.
Do not suffer in silence. While many older people do become depressed, it's nothing to be embarrassed about. Are you going to be embarrassed about a chemical imbalance in your brain?
Yeah, please. Get over it. It's time to let that one go. Right.
There is help available. There's medication available. Depression is not a sign of mental weakness.
That's right. And because of aging, we all have increased risk factors. So there is cancer and arthritis and strokes and other things, diabetes or caregiving duties and all that kind of stuff. We have to recognize this increases our chances of a transmitter imbalance in our brain and also loss. And these are our risk factors. For instance, a case study that we had of a woman who was a grandmother, a loving grandmother, baked cookies, did gardening, kept a spick and span house, the whole thing. But she had lost her husband 2 years before to cancer. And all of a sudden she presents to her family as forgetting the names of the grandchildren. She stopped walking 1 mile a day. And by the way, exercise is huge. But she was disheveled and not taking care of herself. That's another sign of depression. And the daughter called the doctor and said, Mom has Alzheimer's. Mom has Alzheimer's. Well, she had just been in the hospital for pneumonia. Her husband is dead. Things are changing in her life. And once he did the history, found out she was depressed, got her on a medication, and within a few weeks, she was right back to where she was. Just like that. We want you to know that these treatments work. So
take your personal inventory.
That's right.
You get the blues, we all get the blues. But if it's persistent, you have that loss, that emptiness,
Yes.
see your physician.
And be honest with
Be honest,
her.
absolutely.
Be honest with him or her. Tell them, and say, I'm not feeling, and even if sometimes depression comes without sadness. So the doctor might ask if you're blue or feeling low, and you say, well, not really, but I'm irritable, and I don't want to get out of my chair. And so there's a whole gamut, but being honest is going to be the most important thing.
Will just add one more thing, because I went to my physician last week for my annual physical, and indeed they did a depression screening.
That's good.
I was so pleased to see that. They had like a series of 10 questions that were designed to help them determine if indeed you were suffering from depression. So I'm glad to see that's coming on the scene now, and that physicians are starting to take notice.
And one more thing, Peggy, before we close is, what can we do if we have a friend who we suspect is depressed, or who has told us, I feel worthless, I feel down, I don't feel the same? How can we begin this process to help our friends?
Often depression, as we talked about earlier, comes with lack of energy.
Yes.
So you're going to help your friend schedule an appointment with his or her physician.
There you go.
You can make that phone call for them. You can
go with them.
Go with them, exactly, and put them on the road to recovery.
And listen to them. A lot of people do need to vent and to talk, particularly if it is about loss or the fact that I hurt so bad because of my arthritis. To be able to talk and listen to them and then help direct them. And also, please, please, any talk of suicide, do take it seriously. Don't say, oh, don't talk that way. Don't say, oh, come on, you'll get over this. You don't say that. You need to take those things seriously, and you need to call their physician, or if you think it's something that might be imminent, you need to call Life Crisis Center, which is 749-HELP, or go to the emergency room with that person. We can help those people, and we don't want to see that happen. We want to decrease that. It's not an option. It can always be a question, but for many, we don't want it to be an option when we can, in fact, help them.
Well, life can be good.
Life can be good, and if it doesn't get so good, we can do something about it. So, thank you, Peggy, very, very much for a great conversation, and also for our colleagueship through all these years. It's been wonderful.
Indeed.
And thank you very much for listening. I'm Carolyn Stegman, signing off, and see you next time as a volunteer for MAC with Peggy Bradford, also a volunteer for MAC. Take care.